The treatment of Helicobacter pylori is a very serious matter, and I strongly encourage you to seek the services of qualified doctors because there are specific rules or certain strategies for treatment. There are several medications and names of antibiotics that are important to use when treating Helicobacter. All these strategies are outlined in medical documents in the Maastricht Consensus, and they include several antibiotics. For example, amoxicillin and clarithromycin may be combined with bismuth-containing drugs such as Denol, and of course, a proton pump inhibitor, meaning an acid-reducing medication, is always included in the regimen. But sometimes Helicobacter pylori is resistant to certain antibiotics, and in that case, other treatment regimens have to be used. Currently, there are triple therapy regimens where 3 medications are used to treat Helicobacter pylori and this infection, as well as quadruple therapy or 4-drug therapy. In this case, the treatment strategy must include a bismuth-containing drug such as Denol, 2 antibacterial agents, and the proton pump inhibitor. Unfortunately, it is very common to encounter resistance or tolerance of Helicobacter pylori to antibiotics. This is a very cunning bacterium that knows how to adapt, and in such cases it becomes necessary to use a second or even third line of treatment. For example, sequential therapy with antibiotics administered one after another, or rescue therapy where antibiotics that have not been used previously are employed. At such a moment, it is very important to perform a culture or test for sensitivity. It is possible to conduct an analysis called culture and antibiotic sensitivity testing. This way, antibiotic therapy will be much more effective and successful. Treating Helicobacter pylori without antibiotics is a very painstaking and complicated task. Given its variability and sensitivity to antibiotics, one of the options may be the use of immunocompetent drugs, that is, those that boost the immune system. It is also possible to use various traditional remedies and, well, different herbs. Currently, strawberry decoctions are very popular, for example, as they have antibacterial effects as well. They can be used in treatment, but it is simply impossible to guarantee the eradication of Helicobacter pylori by using only traditional remedies. At present, following a diet is very important in the treatment of Helicobacter pylori. One of the key aspects of the diet is mechanical sparing. That is, try to avoid eating coarse foods or fiber because they further injure the mucous membrane. It is very important to include protein-rich foods in your diet because protein foods are particularly effective at reducing the acidity of the gastrointestinal tract contents and help normalize the pH balance. Alkaline mineral waters are also a great aid, so this is a very correct approach. There are mineral waters such as Luzanskaya, Polyana Kvasova, Kuyanik, and many others that are effective in reducing acidities are bicarbonate waters. It's important to use them properly. Heat them to a temperature of 38 degrees, which is very important, and drink them between meals to reduce acidity. Because it is exactly 40 minutes to an hour after eating that the maximum peak in acid production is observed. And this water helps neutralize the acidic contents which Helicobacter pylori really thrives on. It is also important in the diet, and you can use Kissel, a type of jelly-like drink. They are very productive and effective in helping. But kissel should not be made from sour ingredients. You can also use applesauce or kissel made from, for example, flax seeds. They are effective. There is even a special recipe you can use. Pour 3 tablespoons into half a liter of boiled water and simmer for 10 to 15 minutes. Then this mucilaginous decoction is used as part of our daily dietary intake. Be sure to avoid extractive substances. That is, seasonings, spicy foods, fatty or fried foods, anything that can irritate the mucous membrane and put strain on the gastrointestinal tract.